Thank you for tuning in and welcoming us into your homes once again for our COVID-19 briefing. Today, we will have an update from the Minister of Health on items dealing with the Ministry of Health in addition to the latest test results. We'll also have a presentation by the Minister of Finance. Also with us this evening is the Minister of National Security, who is here to answer any questions that members of the media may have. I want to give a special thanks to my Deputy Premier, Walter O'Ban, who stepped in on Monday to lead the press conference while my family celebrated my son's 4th birthday. We'll now begin the press conference with a statement from Minister Wilson. Minister?
Thank you, Premier. Good afternoon, everyone. Between yesterday and today, there were 157 test results received by the Ministry of Health. Excuse me. Yesterday, we did have a technical error with respect to the reporting of the numbers, and we reported 153 results when, in fact, we had received 127 results. However, the total results, again, are between yesterday and today are 157, and no positive results were received. As such, Bermuda's total confirmed positive cases remains at 121, and their status is as follows. There are 47 active cases, of which 40 persons are under active public health monitoring, 7 persons are hospitalized, with 2 of those in critical care. A total of 66 have now recovered, and the total deceased is at 8. The average age of all of our confirmed positive cases is 59, and the age range of all of our positive cases is from 18 to 101 years. The age of persons hospitalized ranges between 68 and 89 years, with the average age being 78. Now that we have a larger number of cases who are deceased, we can provide collated information about their deaths, as there is less risk of identifying those particular individuals. The average age of all deceased cases is 75, and the age range is between 57 and 91 years of age. The Epidemiology and Surveillance Unit has also been able to do more analysis of the racial breakdown of COVID-19 in our community. Today, I can report that, as has been seen in other countries, the impact of COVID-19 is indeed also worse on the Black population here in Bermuda. Currently, 57% of all the COVID cases are Black, 39% are white, and 4% are other or unknown. However, 72% of hospitalized cases are Black, and most distressingly, 88% of those that have passed are also Black. The causes are not fully understood anywhere, but it is generally believed that this is due to underlying health and social economic disparities. There are higher rates of chronic disease amongst the Black population and a greater likelihood of living in smaller dwellings and higher densely populated areas. These factors contribute to the likelihood of COVID-19 spread and its impact. These statistics are also a stark reminder of why preventative measures are also so very important. If we do not wear masks, wash our hands, and maintain physical distancing of 6 feet, we will not fare well as a country. Nevertheless, since the start of the COVID-19 pandemic, a number of people who were hospitalized have recovered and been released, which I think is excellent news. I want to thank the staff of KEMH for their exceptional care of COVID-19 patients. For an example, there is a COVID-19 positive patient in the hospital who last week moved from the ICU to a general ward. That patient says that the nurses helped him through what he describes as a very scary experience. It is the nurses who comforted and encouraged him and helped him renew his faith that he would make it through. And I think this is a wonderful testament to the nurses and the staff at KEMH, particularly during Nurses Month. I now want to talk about the importance of infection prevention and control training. No matter where you work or which industry you work in, the risk of spreading infections in the workplace is ever more present. It is important that everyone knows the risks, how to stay safe, and keep themselves and everyone around them healthy. General measures to prevent and control the spread of infection are critical to combating COVID-19 and preventing its spread. an understanding and appreciation of the general principles, as well as the full cooperation and involvement of the entire team at all levels, is essential to our success. As an employer, it is your duty under the Occupational Safety and Health Act to train your employees in this regard whenever there is a risk to their health and safety, such as that's presented by COVID-19. To help employers with this, the Department of Health has created online training, which has been posted on coronavirus.gov.bm and covers the fundamentals of infection prevention and control of COVID-19. This 50-minute course is for all employees and management, and I encourage all employers to be aware of this training and to share it with their staff as appropriate. Today, I can share with you the estimated real-time production number, the RT, of the COVID-19 for Bermuda. The RT is different from the basic reproduction number. The basic reproduction number, referred to as the R0, is the average number of susceptible people infected by each infectious person. The R0 is a static number, and currently it is estimated at 2.4 for COVID-19, and it is based primarily on the characteristics of the infection. In contrast, the real-time reproduction number, or the RT, depends on additional factors, including personal behaviors and interventions made to reduce contact between infected and susceptible persons. Its value will change over time, as all of those factors also change over time. The current estimation of the real-time reproduction number for Bermuda is 0.47, but this can fluctuate a great deal in a small population such as ours. And this is promising, as our goal is to have an R at near or below 1. The real-time R is just one indicator that can be used to understand the impact of our mitigation measures or our non-interventions and the country's overall status. This number will continue to be monitored and factored into decision-making for moving to future phases of our reopening. The ministry will use the RT number as well as public compliance with physical distancing, hospitalizations, and other factors to make recommendations to Cabinet as to when we move to the next phases. And finally, I want to end with a request. Please, Bermuda, use care and caution when operating vehicles on the road. Since the shelter-in-place regulations were released, there is increased traffic on the road between 6 a.m. and 10 p.m. Excessive speeding poses a threat to the safety and well-being of not only the operators of the vehicles involved, but other road users, especially the increased number of individuals that we've seen on the roads doing exercise. It is our responsibility as good citizens of our country to practice and promote road safety. And during this time of a COVID-19 pandemic, we should also be very mindful of the impact that preventable road traffic collisions can have on the capacity of our hospital. So please work with us as we exercise care, caution, and courtesy on our roads as members of this community. Thank you, Premier.
Thank you very much, Minister. And it's certainly encouraging to get that particular information regarding our real-time reproductive number. Yesterday was International Nurses Day. Yesterday, Minister Wilson released a video thanking nurses in Bermuda for their tireless dedication. Nurses play a vital role in each and every healthcare system around the world, making a difference to the lives of their patients and their patients' families. In Bermuda, your endless dedication is recognized and appreciated during regular times and is highlighted as we move through this global pandemic. On behalf of the government and the people of Bermuda, I add my sincere appreciation to the 751 registered nurses in Bermuda. I also want to recognize the dedication of nursing assistants and everyone involved in the healthcare of Bermuda's residents. I also would like to extend a thank you to everyone who is involved in the operation of Bermuda's testing facilities. Thanks to the collective effort of all, on Monday, Bermuda entered the top 10 countries per capita in the world for testing. However, this is not a competition between countries. But the more that we test, the more we know about the virus and its spread in Bermuda. Over the past couple of days, we took a bit of a break from testing. So as you see, there are not a lot of new results today. Over the next few days, we will be testing and retesting essential workers and our seniors' homes, and we will also offer testing to persons in correctional facilities while continuing the open testing of the population this weekend. Antibody testing started last Saturday at the government drive-through testing facility at Southside in St. David's, and the government is now administering two types of COVID-19 tests for the general public. As stated last week, the PCR test, or polymerase chain reaction, detects the presence of COVID-19, thus identifying anyone who has an active infection with the virus. This test is administered through a nasal swab. PCR test results enable the Ministry of Health to detect who has an active infection, isolate them, and identify those that they have been in contact with. The antibody test is to determine the presence of the body's immune response or antibodies and is administered through a finger prick blood sample. This enables the detection of individuals who have had COVID-19 in the past and who may not have been detected in previous testing regimes. Moving on to give a little bit more information about the technology surrounding the notification of the results. As of 3 p.m. today, all those who booked appointments to be tested between April 24th and May 11th would have received their results by email yesterday and today, as it was just a recent system upgrade. Those who came as walk-ins have been called by a medical professional with their results, and they are also being entered into the system to get an email. From tomorrow, when the testing at Southside resumes, all doctors will have access to their own portal where they can see the patients who have listed them as their doctor. From this portal, they'll be able to see the results easily, run daily reports, and also download reports for patient files. As of May 11th, 2,426 tests have been conducted through drive-through. Some of the challenges which prevented the results from being sent quickly include no doctor listed, people listing themselves as their doctor, and old email addresses for their doctor. I'm also pleased to report that news from the government lab indicates that everyone who was tested up to yesterday would have received their results as of 3 p.m. today. There was a delay in getting some of the results back over the weekend. However, those issues have been resolved, and testing results will now be turned around in 24 hours. Due to the overwhelming response by the public to be tested for COVID-19, most of the available appointment slots have been taken at Southside at the drive-through testing facility. In response to this exceptional demand, operating hours for this coming weekend were extended from 9 to 7 p.m. However, I'm informed that all of those slots have been booked, and there are 687 persons who were slated for testing between now and over the weekend. I can report that next week, more spots have been opened, and the slots are available to the public for booking on Monday and Thursdays. However, some of the days are going to be reserved for the testing of specific essential workers who may be involved in phase 2 reopening. So not all the days are open, but there are some slots which are open for next week's testing currently. Also, starting tomorrow, an additional lane will be open for essential workers between the hours of 10 a.m. and 7 p.m. Essential workers include members of the Royal Bermuda Regiment, Bermuda Police Service, Department of Customs, Bermuda Fire and Rescue Service, and those persons can book directly with their office administrator, as the online portal for the essential workers has been shut down to make sure that, and as we open up one for the general public, essential workers are able to go ahead and book through their particular establishments. Finally, if you're looking for the link to go ahead and book your tests, it can be found at our website, coronavirus.gov.bn, and that is for the general population. Most of the slots are filled for this coming weekend. However, you can now book slots for next week, Monday, and next week, Thursday. COVID-19 has devastated the global economy, and as we've sought to protect the health and safety of our community, we have also been focused on ensuring that the economic effects of COVID-19 will not be worse than the health impacts of this pandemic. With us now is the Minister of Finance, the Honorable Curtis Dickinson, with an update on the work being done with his team. Minister?
Thank you, Premier. Good afternoon. It has been several weeks since the government passed legislation on March 24th to provide unemployment benefits to those impacted by COVID-19 related job losses. In a very short time leading up to and during the shelter-in-place orders, we architected and implemented a new system from scratch and collected an unprecedented number of applications from individuals and employers. Unfortunately, necessary details required to ensure entitled individuals only were receiving benefits in accordance with the regulations were either missing or inaccurate in a large number of applications, resulting in many failed payments and ultimately in delays in receiving badly needed benefits. Over the last couple of weeks, much of this has been cleaned up, and significant improvements to the system have been implemented. Resolving a lot of the initial challenges has not been an easy task, and the team deserves a lot of credit for answering the call and working hard to deliver benefits to a large number of people. This week, we are paying benefits to over 7,000 applicants, totaling approximately $7 million. Including this week, the program will have paid an aggregate of approximately $22 million in benefits. I'm happy to report that over 500 individuals that were receiving benefits have returned to work and informed the government. I want to remind everyone, both employees and employers, that you must report the date you're returning to work immediately to the Department of Workforce Development. You may do so by emailing your information to unemploymentbenefit@gov.bm, and the information will be your name, your employer, and your social insurance number. To navigate appropriately through this crisis, we will require the input and advice from all stakeholders in the community. As mentioned in my ministerial statement on Friday, the 8th of May, I have established a COVID-19 Economic Advisory Committee. The committee includes key stakeholders in the Bermuda economy and community. I can confirm that the terms of reference have been drafted, and the first meeting will be held next week. At this meeting, the terms of reference will be reviewed by the committee and ratified. The role of the committee is to provide insight and expert advice on how to protect jobs and stimulate economic activity during the economic crisis stemming from the COVID-19 pandemic. The objective of the committee is to assess and recommend prioritized, impactful strategies for the short, medium, and long-term economic recovery from this crisis. More specifically, the committee shall solicit and obtain information and ideas from a broad cross-section of the community and all sectors of the Bermuda economy about the functioning of the economy and potential recovery initiatives. It will provide prioritized recommendations on the design, implementation, and evaluation of policies to promote growth, create jobs, and improve the long-term prosperity of Bermuda. It will provide analysis and information for the operation, regulation, and healthy functioning of the economy. It will engage, direct, and liaise with subcommittees as needed for the development and implementation of approved recommendations. And it will review, assess, and propose changes to government and government corporate bodies and agencies. I will chair the committee, and its membership will include 10 other individuals. The committee will include representatives of all key sectors of the Bermuda economy and will also invite other participants to participate and provide information. To ensure full participation in the process and increase efficiency, the committee may also establish various subcommittees as it deems appropriate to arrive at the best outcomes for the country. These subcommittees may include business owners, industry associations, key individual stakeholders, and public officers. Subcommittees are anticipated to have an industry focus and may include tourism and hospitality, technology and infrastructure, financial services, retail and services, social services and healthcare, and development and construction. The subcommittees will present their observations, findings, initiatives, action plans, and recommendations to the Economic Advisory Committee for review and consultation. I look forward to starting the work that is necessary to identify and eventually implement the measures, economic growth, and mitigate the social impacts of the pandemic. I am pleased to confirm that today the Senate passed legislation amending the National Pension Scheme Occupational Pensions Act of 1998 to permit a person under the age of 65 who participates in a private defined contribution pension plan or local retirement product to voluntarily withdraw up to $12,000. This legislation will now be sent to the governor for his signature. Once the legislation has been brought into operation, a member or a former member of a pension plan or local retirement product under the age of 65 will be able to apply to their administrator for a one-time refund of up to $12,000. If their application is approved, the plan administrator will have up to 20 working days to make the payment. The Senate also passed regulations to allow members and former members of a pension plan or local retirement product to receive a refund of up to 25% of their account balance, provided they have attained normal retirement age of 65 and have retired. The Pension Commission will be providing specific guidance to the plan administrators to make the entire process as efficient and timely as possible. Thank you.
Thank you, Minister. And I do want to commend your team and also the team within the Ministry of Labor, Community Affairs, and Sports for ramping up this unemployment program and making sure that we were able to get this program up and running so quickly. We'll recognize that there are lots of countries that are far larger than ours who have not been able to effectively release that in our country. We were able to have the foresight to get this up and running very quickly, to be able to provide that support to persons who need it while we make sure that our country remains healthy. I'm sure that many persons are curious of the move to phase 2 and when that might happen. At the cabinet meeting yesterday, I can confirm that no decision has yet been made on when we will be moving towards phase 2. As we said when we mentioned these particular items, there are no defined timelines that are set, and there has been no decision to move to phase 2. However, with the R number, which the Minister of Health has reported being below 1, we do possibly have the capacity to move forward. A cabinet subcommittee will be meeting tomorrow, consisting of the Minister of Health, the Minister of National Security, and the Minister of Public Works, who will meet to discuss whether or not an official recommendation will be made to the cabinet on moving to phase 2 at some point in time in the near future. And I look forward to sharing that information with all of you when I next see you at this press conference on Friday. As we have mentioned previously, there will be a flight arriving from Atlanta this Friday. All passengers who arrive in Bermuda will be required to stay at a government quarantine facility. The only persons who are exempt from this requirement are those who present medical evidence to the Minister of Health in order to be exempted from staying in a government quarantine facility. Those persons who are allowed to quarantine at home only for medical reasons will still be checked by the Bermuda Police Service on a regular basis to ensure that they are maintaining their quarantine. At the end of the 14 days, persons, whether or not they're in a quarantine facility or at a home due to medical reasons, will be tested for COVID-19 before they are allowed to be released from any type of quarantine. We have also received a number of questions about a possible flight from Canada. If you are a Bermuda resident looking to return home from Canada, you can go to the website coronavirus.gov.bm and click the link COVID Forms to provide your particular details under the traveler form for travelers who are looking to return home. If you have already filled in this form, you will receive updates on any particular flight. Right now, we are working to gauge interest in a flight and capacity to fill a plane. Also, if you are a Canadian resident and you wish to return home from Bermuda, you can also contact Travel Edge and register your interest for a flight. Before I end this evening, I would like to read an email I received last Friday from a member of the public. The email was addressed to me and to the Minister of Health. And I quote, "Good evening, Premier and Minister Wilson. My mother is presently in a senior rest home which was tested yesterday, the 6th of May, for COVID-19. Today, I received a call advising me that an online site had posted and I quote, third rest home comes up positive for coronavirus, end quote. As you can imagine, I was very upset upon hearing and reading this, even though the name of the seniors rest home was not given. Clearly, there must be a breach in confidential medical information somewhere. This reporting can invoke worry and unnecessary stress for all family members of patients of Bermuda's senior rest homes. Minister Wilson, you always mention at the COVID-19 updates to be sensitive to families. It appears that this particular news agency is not being mindful of that. Premier, I would like to thank you and your team for keeping us informed via the televised and online updates during this national crisis," end quote. There are two clear messages that I wish to give this evening. If you are employed by a senior's home and have access to patient information, you are in breach of confidentiality agreements by sharing information with people outside of approved family members. Given the sensitivity of the information around positive results, I urge those persons phoning, emailing, and sending WhatsApp messages to stop giving this information to the media prior to families being notified. Families should not learn about sensitive health matters through media outlets. And as you see in this particular instance, it doesn't necessarily matter if the home was named or not, because family members know that particular homes are being tested. And as the Minister of Health said, we are doing testing of nursing homes, but we will also be doing retesting of nursing homes. And it is particularly important that this is kept in mind. My second message is to members of the media who are comfortable breaking news and sharing sensitive information about the health and well-being of the most vulnerable members of our society. Even if you get what you may deem to be exciting information that must be shared immediately, I beg you to stop and think. Think about the impact on family members who have loved ones in the homes that you're writing about. Think about the added stress and concern that you may be causing these families unnecessarily, as the government will be in the process of notifying persons whom have been tested. Understand that the definition of news is also reaching residents who are now given the extra stress, and families who are now given the extra stress about worrying whether or not they have tested positive, and the fact that the general public may know before they do. For Bermuda, we are addressing a situation that we have never faced before. And this is the time for us all to work together and for us all to support each other. This is the time to think about others. There are those in our community who have been afflicted with COVID-19, and with that comes a lot of anxiety and concern, not just for persons who have the virus, but also for persons in their household, their family members, and friends. We must all do what is right, and we must all do what is in the best interests of our community. We are a very small island, and with very little information, we can somewhat accurately identify most people in any given situation. This is why the government has been so careful with the testing results, the statistics of which we release, and I want to continue to ask all of us to try our best to respect others' privacy. As we conclude tonight's briefing, and before I open to questions, I extend my thanks to everyone who continues to show kindness and generosity. This afternoon, my family joined the children of the essential workers at the Essential Workers School at the center on Angle Street, as Ms. Kellyanne Pacheco of the local company Party Animals provided a drive-by character motorcade. The children at the school and my family thoroughly enjoyed it. So thank you, Party Animals. While the hours may be long, the task daunting, and the emotional toll of protecting people's lives can be overwhelming, none of us who are sitting here at this podium would be able to do the work of which we continue to do without your support. The calls, emails, social media posts, and messages of support, encouragement, and prayers for our safety and success are truly appreciated. When the days seem darkest, please know that those simple acts of kindness and compassion truly brighten our days. Before I go to question, Bermuda, we have made progress, and the results of which we are continuing to get are certainly something that is a cause for optimism. But I cannot express enough that if we move too quickly, if we relax our guard, if we stop practicing the efforts of which we've been doing over the past 2 months, this virus can come back and jeopardize all of the progress of which we have made. So while there may be space for us to move to phase 2, it cannot happen if we are not all doing our part. And that means very simple. Maintain your physical distance, wear a mask wherever you go, and make sure that you're minimizing your contact with as many persons as possible. With that, I'm happy to take any questions that members of the media may have.
Good evening, everyone. Maya Plaster here for Media Maya. My first question goes to Minister Wilson. If by possible, you mentioned earlier about all the demographics in Bermuda and how it relates to COVID-19 and Black, white, and other. Could you possibly say the entire island-wide demographic, as that could help people understand why maybe the Black population is so much higher, because our demographic does have a higher Black population on the island?
I'm sorry, do you mind repeating your question again? I'm trying to.
Can you give me the figures as to the island demographic of Black, white, and other in Bermuda, and not just for COVID-19?
Oh, I don't have that with me, but that's publicly available information from the last census on the Department of Statistics. You could get that, but I don't have that at my disposal, I'm afraid.
Okay, thank you. My next question, Minister Keynes. I was wondering if there was any updates concerning Cheval Dylan Burgess, if you could give any from last Monday's press conference.
It is still an active police investigation, and there is nothing that I can share at this time.
Okay, thank you. My next question, I don't know who it go to, probably you, Mr. Premier. Teachers were asked to submit a form if they were deemed vulnerable persons with a condition that may prevent them from physically being in a school building during the COVID-19 pandemic. And I'm wondering, how does that call to action to submit personal health information affect when schools will be opening?
Could you possibly ask that question one more time?
Sure.
Ms. Palacio?
So teachers were asked today to submit a form that deemed whether or not they are vulnerable persons and how that may prevent them from physically being in a school building during COVID-19 pandemic. So I'm wondering, how does that call to action affect when schools will be opening? Like, is the government planning on opening it soon, later?
Well, I don't think that that is actually going to affect school opening, but what I think that you've seen from all departments of government as we move forward into phase 2, phase 3, and phase 4 is the necessary planning, which is necessary in order to get us to those particular points in time. So when we are looking at the particular issue of education, there's a number of factors which have to come into place if there is a consideration to open schools as we move into phase 3. And so from that perspective, I think what you're seeing is the Minister of Education and the Department of Education making sure they collect the statistics which are necessary to judge on how the schools may or may not be able to function. So I know that there's a lot of particular information that has been sent out to teachers. There's information that'll be sent out to parents as well. And we're going to continue to collate that information so that we can move forward in the interests, I think, of of student safety. But it is something that I've stated that it is very difficult to get your economy moving again if persons are not going back to school. It does lessen productivity inside of your economy, but we are not going to make any moves in this country unless it is safe to do so.
Thank you. Those are all my questions for this evening.
Thank you.
Oh, afternoon, all. Belated birthday greetings to your son, Mr. Freeman.
Thank you, Jonathan.
Got a few questions here. I'm figuring the Minister of Finance will be able to take them. So we totally hear you at this. This is something that we haven't prepared for, and it's something entirely new. To do with the unemployment benefits, today we've been getting some horror stories from people who've had to choose between food and medication, people who sent in their information as part of a group that was organized by their employer. Only a few of them have received payments, others just haven't gotten anything. And that the phone line just doesn't work. There's a 10 to 1 countdown and you get to 1 and it hangs up on you. Now that was as of today. I guess, can you walk us through a bit of what's going wrong with that system? It's been, I believe, 6 weeks now.
Well, thanks for the question, Jonathan.
Sure, sure.
You will appreciate that this initiative was started from scratch.
Mm.
And the impact of COVID-19 from the beginning of the shelter in place had reduced hours or were put out of work. And so the volume of applications was overwhelming. And then on top of that, you had persons who were unable to complete an application at a first try, who tried again and again and again. Over the course of the last couple of weeks, I've sent a team in to do a bunch of remediation work on the application. That work included identifying cases where duplicates, where triplicates, sometimes quadruple applications were put in, cleaning that up. There were instances where persons had incorrect or incomplete banking information, or situations where employers were not able to validate the information for employees. The way we worked through that initially was whether your application was approved or not at the first payment cycle, folks were paid 2 weeks of benefits. And then we went back to try to fix the things that were incomplete. But I accept that for some people, this has been a difficult challenge to overcome, not getting paid. But we have worked really, really hard to ensure that the majority of people have been paid. And I think that work has been yeoman's work. And we have had today, I mentioned earlier, over 7,000 people will get paid by the end of this week. If persons are still not receiving benefits, I accept that there's an issue with the telephones in terms of them being answered quickly. Please send an email to unemploymentbenefits@gov.bm and let us know so that we can pull your file. And what has been happening is those persons who have been unable to get through in one channel have tried to call persons who they know who work in the government. And I've gotten outreaches from folks, and we've been able to kind of understand where that person's application is and address it.
Thanks. So do you have a ballpark figure on how many folks have not yet been paid under the scheme?
I don't have the number at my fingertips, Jonathan. What I do know is that we talked initially about a number in excess of 10,000 in terms of applications. What we now know is that a number of those applications were duplicates or triplicates. And so the numbers, there was some double, triple counting that was going on. And I think over the course of the last week, we've actually had the workforce development team only have read or write access, while my team has worked on remediating the data.
Thanks, sir. Last question. Can we get a guarantee of a day coming when these unpaid folks can get their benefits? Is there a date that we can say at this point the people who are waiting on it are going to be able to receive it?
I think what I can commit to, Jonathan, is so we've made four payment cycles, and at each pass we've tried to go back to identify those instances where in a payment cycle persons have been unpaid, and those folks who have been unpaid have been the focus of us getting them paid. And so this week, a number of folks who hadn't been paid previously will see that they get paid more than one cycle's worth of payments. So they may get 2 or 3 weeks, 3 payment cycles, so up to 6 weeks of benefits. What I can promise is this: if you've been unemployed at the introduction of this program up through when you get reemployed, you will receive your benefit.
Thank you, sir. I believe I neglected to identify myself for the listeners. It's Jonathan Bell from the Raw Gazette. I'll now pass over to my colleague.
Good evening, everyone. Jonathan Kent from the Royal Gazette. I'd like to ask the Finance Minister a question. In your ministerial statement last Friday, you spoke of an opportunity for a profound shift and added that opting out from taking tough decisions is no longer an option. Could you explain what you meant by profound shift and which tough decisions you are referring to?
When you have an opportunity like this pandemic, it challenges you to think about the way that you do things and the way that you're going to do things going forward. It presents a real opportunity for real change. I have said from this table before, and I think I've said on the floor of the House of Assembly and also in press conferences, that all options need to be on the table when considering how we move this economy forward. And I meant what I said when I said those words, that we need to think about everything that we do with the view towards, can we do it better? Is it necessary? Can we do things differently?
Okay, and you also spoke in that statement about attracting new business to the island, playing an important role in the economic recovery. What sort of policy changes and legislative changes would you like to see to make the island more attractive in what's going to be a very competitive environment among jurisdictions?
One of the things that I was doing in making that statement, Jonathan, was kind of setting the table for the expectations around the work that's going to be done by the Economic Advisory Committee. And I want to socialize that kind of thinking with the broader Bermuda public. What I want from my committee is bold ideas around how do we transform this economy. There are things that we do today that we do very well, and we'll probably continue doing those things. And there are new opportunities that are out there that we probably, because of just time and being comfortable, have chosen not to take advantage of. This crisis presents a unique set of opportunities for us to kind of reconsider things that can position Bermuda to be better going forward. And I think we need to be open to receiving those ideas. I'm looking forward over the course of the next couple of weeks, couple of months, of working with this economic advisory team to formulate a strategy around how we move Bermuda forward. I can tell you over the course of the last few weeks, I've been overwhelmed with recommendations, suggestions from people from all over the country around how we can do things differently. I want to run those ideas through the filter of this committee, who are all excited about being asked to join and contributing positively to Bermuda's future.
Right, one final question again for you, sir. Heather Thomas, the Auditor General, a couple of weeks ago, she publicly reminded the government of the importance during a period when millions of dollars are being paid out in a pandemic-related relief. How are you managing to maintain good financial controls and keep track of the outflow during this period?
Well, I don't have any disagreement with the Auditor General's statement around sound financial management. I think if you look at all of my statements, either in the House of Assembly or in press conferences, I think the theme of sound financial management has been consistent throughout all of my statements. I know that my cabinet colleagues will have no issue kind of agreeing that I'm a pretty strict taskmaster when it comes to this kind of stuff. I think the Auditor General was talking about two things in particular. One may have been the unemployment benefit program, which we pulled from start fairly quickly and had it operational. I am of the view that the perfect cannot be the enemy of the practical. And in delivering benefits to people, we had to do some things fairly quickly. Did we dot all the I's and cross all the T's? No. And that's what the last few weeks have been about, making sure that we haven't created any real harm. I'm of the view that we did some really good work supporting people who needed our assistance. And I've said, I think publicly, and I've said privately, that I will, if I messed up on something in order to get somebody food on their table to support their families. The other thing I think she was speaking about was the financial statements for the government. And I've also said publicly that I'm committed to getting that issue addressed. And I've tasked my team with getting on with the work of getting these statements brought current. That's going to include going outside of government, Auditor General. I've accepted
Good evening, Minister of Finance. The people who have taken early retirement and who are under the age of 65, would they be eligible to apply for drawdown on the 25% of their pension?
Good evening, Trevor. The rules are the person needs to be 65 and have retired. So if they've taken early retirement and are not 65, then they don't qualify.
Okay, with that said, I have a lady that has retired, but she still has a part-time job. She's in the middle of renovations, and she would like to know what's her options moving forward.
Has the lady turned 65?
Yeah, she's 65. She's retired, but she still has a part-time job.
I think her retirement status, as far as I know, has been determined when she finished her first job. So if she has a part-time job to sustain herself, that shouldn't be an impediment to her being able to access her funds.
Thank you. I'm sure she's listening. Minister of Health, I'm sure you've been watching overseas media that's been reporting a second wave of this coronavirus, and with young children being affected. What are you preparing for by any chance this occurring here in Bermuda?
Well, I think that's a very good question, Trevor, and I'm sure everybody that's been watching that, particularly as it relates to younger children, it is causing concern. I actually have I have weekly meetings with the hospital, and we'll be discussing part of that will be part of our agenda tomorrow, insofar as the level of preparedness that the hospital has concerning the smaller population of our children in particular. I am satisfied, based on the conversations that I've had with the hospital heretofore, that their level of preparation involving all patients, regardless of the age, it exists, but that is certainly something that we'll be discussing tomorrow. But we are watching it, and it is certainly a cause for concern.
Thank you. Minister of National Security, I've been told you got about 4 inmates that are presently at the prison farm awaiting and have been waiting for about 4 months for parole. And because of this epidemic, it's put them on hold. What might you say to comfort them that's been going through the process and just waiting?
There's no right to parole. The parole board is in the process of looking at all the inmates' queries, and there is the head of the parole board has a plan. We're going to look at meeting remotely, as everyone can understand that we are indeed going through a pandemic, and we just had to test and adjust our position a bit. I do understand that there are people that would like their freedom, and that is something that is at the forefront of our minds, and we will indeed put together a plan where they can understand what is next, and a phased release if it is indeed the decision of the parole board.
Thank you. My second last question, this one might go to the finance minister. I've been very much aware that, let me back up. Who is safeguarding and almost a watchdog to make sure that these unemployment benefits are going through records that are here on island? Because I know of a few hotel workers that are off island. They went away prior to the shutdown. They were on vacation, but the unemployment benefits were put in by their employers, and they're receiving, and they're not on island. Who safeguards or is a watchdog for such situations like this?
Well, Trevor, I think you said there may be a few instances of this happening. I've been made aware that an employer mistakenly submitted applications for a couple of their employees. I think based on the majority of the information that we have in the data from the database, I think we have done a very good job of ensuring that only persons who are on island are actually receiving the benefit. In as much as 3 or 4 people may have slipped through the cracks, we'll work to kind of fix that. But by and large, I think we have done a very good job of validating that persons who are entitled are actually receiving the benefit.
Thank you. Premier, my last question. With Bermuda under the COVID-19 epidemic, as we know, funerals have been limited to 10 persons in attendance. Services are restricted to 30 minutes, 45 minutes at best. I know this is not an issue, no fault of the government, but there are issues with funeral homes and undertakers that are still charging full price, and the client are receiving only half of the service. What might you say to encourage businesses, these undertakers, to be considerate in such a time?
I think, Trevor, you're correct that it's not necessarily an issue for the government in this particular regards, and I am not an expert on what is required insofar as funeral homes, but I'm sure there's a similar amount of work which may or may not be required, and I'm certain that individuals can have that conversation should the unfortunate circumstance arise where they would have to bury one of their family members. Go ahead.
Trevor, the Ministry of National Security will be setting up a meeting in the not too distant future with the funeral directors, not necessarily dealing with any payment matters, but dealing with funerals going forward and what it looks like at the actual funeral procession, and seeing if we can regularize some things that we indeed see to be concerning in our ministry.
Thank you much. Thank you.
Good evening, Don Burgess, Bermuda Broadcasting. Health Minister, I know it's still early days, but from the new cases on Monday, do we know how they got COVID-19? And if yes, were they imported, passed on from a family member or coworker, or were they from a rest home?
There were 3 cases that were reported since Monday. 1 was imported, 2 were local transmission, 1 via home, familiar contact, and the other workplace.
Thank you. We are hearing from frontline healthcare workers that some worry that they might have the virus, but are reluctant to get tested because if they are positive and forced in self-quarantine, they are worried they will not get paid. Would frontline healthcare workers continue to get paid while in quarantine?
That is a good question, and I want to answer that in 2 ways. One, I think it's incumbent upon all persons that are particularly on the front line, that they take proper steps and measures to ensure that they are tested for their own safety, of course, and as well as the persons that they are caring for. And secondly, with respect to the quarantine, if an individual is test positive and they are required to be in quarantine for the 14 days, obviously depending on the terms of their contract, I do not believe that they would be financially prejudiced by having to stay home in quarantine because that is an obligation, a legal requirement because of that particular diagnosis.
Thank you.
Mm-hmm.
We have not seen evidence yet to suggest the hospital is overwhelmed. Is there a plan to lift restrictions on elective surgeries?
Not at this point. Again, I'll be having a conversation tomorrow with the hospital, and that is certainly something that we explore on a weekly basis. But at this point, it is still, notwithstanding what the Premier indicated, that our RT factor has dropped below 1, but it still is important for us to be on our guard, so to speak, to quote the Premier. And at this time, it would certainly probably not be a consideration of the hospital for them to allow for elective surgeries, not right now.
All right, thank you. National Security Minister, yesterday, the National Hurricane Center issued a notice for the first tropical outlook for the season. With all the attention focused on battling COVID-19, how are the preparations going for hurricane season, and what challenges may we face in dealing with COVID and a hurricane?
Thank you for that. The hurricane season starts June 1st and ends November 30th. The Ministry of National Security, in tandem with preparing and dealing with COVID, has also been working on our hurricane strategy. The first week in June, June 3rd, we are looking for an EMO executive meeting where we will set out the plan for the government dealing with the hurricanes over this year. Last year, as you know, we gave a number of our supplies helping the people in the Bahamas, and we had a hurricane as well. We are in the process of ordering and replenishing our tarpaulins and other supplies. We understand that we have to be able to deal with COVID as well as dealing with the hurricane season, and we are prepared to do so. We have a team called the Disaster Risk Reduction and Mitigation Team, and they have a element of our team that is indeed focused on COVID, but will also propel themselves forward and prepare for the upcoming hurricane. We've just received information over the last 2 weeks from the Hurricane Service that it's going to be a pretty active season. And so we want to make sure that the Bermuda Regiment is prepared, that the Durham is prepared, that we have all of the adequate information. Again, we will meet in just under 2 weeks. We set out our plan. We'll give everyone the marching orders. We'll make sure that we have everything that is ordered that we need for hurricane season. And I believe, as always, we will be prepared to deal with any eventuality as it pertains to hurricanes.
All right, thank you. Mr. Finance Minister, with regard to unemployment benefits for those most likely to be long-term unemployed, has any consideration been given to the idea of engaging them in new infrastructure projects?
Thanks for the question, Don. I think I have to believe, I think we all believe that persons who are out of work would rather be at work. And in as much as there are opportunities created by infrastructure projects and they have the skills to do them properly, then they should be considered for them.
Thank you. And finally, I know I asked this on Monday, but since you're here, with regard to, will the government consider the dropping or lowering of import duties on food to bring food prices down?
I've said it before that all options are on the table. They're all on the table.
Thank you very much.
You're welcome.
Excellent. Thank you very much. With that, I would like to say to those at home are challenged due to the emotional stress that this particular situation is causing, please make sure you take advantage of the mental health hotline at 543-1111. It is very important. I look forward to speaking with everyone on Friday, where we will have the outcomes and further news as to the next steps of which the government will be taking in the gradual reopening of Bermuda and any timelines which may be laid out. I just want to leave you all with this, a reminder that it is critically important that you maintain your physical distance. When you're outside and in close proximity with others, make sure that you wear a mask, and let's do our collective work to keep our R number under 1 so that we can move forward into the reopening of Bermuda's economy. Thank you and have a great evening.
The month of May is Heritage Month, a time when all Bermudians have the opportunity to celebrate our